What makes you feel fearful in your practice? What's scary to you? What worries you the most? What are the things that make your heart flutter and not in a real good way? What are the things that make you feel like maybe your blood pressure is rising? What are the things that make you feel like you want to run and find out tomorrow how things are going? Let me tell you some of the things I wrote down that I think could be part of that list. Certainly for me, I've experienced some of all of these. Number one, how about we sometimes feel very afraid of doing something new, something different, something we've never done before. It takes a lot of courage to learn implants, to learn new periotherapies, to learn orthodontics, to learn anything new materials. That can be very, very frightening. What about the feeling that maybe this doesn't work? Maybe it won't work. Is this actually going to do what I need it to do? Or is my patient going to come back complaining? It maybe won't work. That's another one. How about how much money is this going to cost me? Because I'm here to make a living and it's getting hard. And am I going to spend too much on this? That's another one. How about, am I going to look silly? Am I going to look silly to my patients? Even am I going to look silly to my staff because they're probably judging me? That's another thing that worries us because we're human and we want to look capable. We're professionals, for heaven's sakes. That's why we often fall into the trap of doing the things we've done over and over and over and often expecting a different result. And you know what happens then. As Einstein said, that's insanity. Can't do the same thing over and over that hasn't been working and think it's going to be different this time. But that's what we do because we're afraid. It's so easy to be fearful. How about someone might find out? This might get out that I'm not doing this well, that I'm not good at this. My patients are unhappy or might be unhappy. How about the patient that you can hear out of the treatment room? You hear them down at the front desk complaining, and they're not happy about their insurance, about your fees, about whatever. There are so many things that can make you fearful. Today, doctor, is the day to get courageous, to start deciding that these things are going to have to just be. Yes, you're going to have these worries. Yes, you're going to have these experiences, and you are going to feel that maybe things won't work, and that what if. But the only way to live and in practice that's joyful and that is rewarding and that keeps growing and that your patients are thrilled is to be brave. So understand we all have fears. We all have worries about how it's going, what we're doing. Today's the day to get courageous. And as you do your new things, as you do your old things, as you hear the complaining patient, take a deep breath. Think of what you're grateful for. Think of what's good in your practice and just keep moving along in joy and watch for the abundance, for the peace, for all of the goodness that comes when you're grateful and when you keep on facing your fears and moving on. Good luck with that. We all have to do it.